So, how is your intake process needed to change through the years in order to maintain low barrier services and survivor defined services?
Yeah, we went from a screen out approach when I first started here 9 years ago as an advocate. I was told if you ask people before they come in, you ask clients, survivors before they come in if they are using any substance, and if they say yes, you tell them the shelter's full. And so it was, yeah, it was a complete screen out, deceitful approach. And then when, leadership turned over and things, we started looking at things differently, really did an evaluation and an assessment of what we were doing, switching from that idea to screening in for services.
Mhm.
That was the beginning of the intake process changing. And then really you can change what's written on a paper as many times as you want, but until you change the culture around these topics in the organization, nothing's going to change. So the next step was we can screen in. Now we have to train everyone. What does that actually mean? How do you screen in? How do you move from focusing on reasons why someone can't stay to focusing on reasons why someone should stay? So I think kind of twofold. We changed the formal process, but then also change the culture in the office and the agency to support that process.
Yeah, I can imagine that that took longer than changing the paperwork.
Much longer. It's still ongoing. It's every day. Yeah. The paperwork took 10 minutes. The process took 10 years.
Mhm. Yes. And so, along with those changes, as your program started to be more accessible and inclusive for survivors who use substances, I imagine that you needed to integrate different kinds of substance use services that maybe you didn't need before. So, what does that look like?
Yeah, I remember one of the first sort of deep conversations and adjustments we made in this world was we had a survivor we were serving who was on medical assisted treatment and had to bring the medication in a lockbox to store over the weekend because I guess the facility where she got it gave her enough for the whole weekend, and bringing that medication into the building became a whole thing. Like it was way over analyzed by staff. What do we do with it? Where do we put it? Oh my gosh, what's going to happen with it? And it was it's treated as if it's any other prescription medication. So I think it changing our approach, really, if you can change the belief structure, it gets the foundational beliefs, it gets a little bit easier to put it into practice. But I think, yeah, integrating just even little things like that, how does someone access their medically assisted treatment? So if we're going to give someone a ride to see their cardiologist in the agency van, why would we also not use the agency van to give someone transportation to their medical assisted treatment program? I think changing the framework around how you see someone accessing those services will drastically change how someone actually accesses those services, if that makes sense. So integrating access to those programs into our services, and instead of recreating the wheel, how do we see what our community is already doing, take advantage of that, and then also support survivors knowing that accessing those treatments alone creates a stigma, right? Just people knowing that we have a shelter that openly and successfully accepts people who have substance use disorder, that's already stigmatized. So in the community, how do you combat that along with the survivor?
Yes. So it's first and foremost addressing the stigma
Mm-hmm.
within all the policies and practices within staff, and that as you're able to address that stigma, and really what I'm hearing is uphold health equity, that then it becomes much easier to
Mm-hmm.
figure out what that looks like, what
And
needs
how
to
to integrate
happen.
it into what we're already doing. Mm-hmm.
Yes. And then also not having to reinvent the wheel, becoming aware of what kinds of services and supports are already available in the community. Although, there's never enough resources to meet the need, really, in any field, any human service field, but plugging into what does exist.
Yeah, and making it as accessible as possible.
Yeah, so really helping to address the barriers, locate resources, address the barriers, facilitate. This sounds like what advocates do every day.
Yeah, that's the other piece. And I remember in West Virginia when we, like, as a movement, integrated human trafficking services, there was a lot of pushback. And it's similar pushback to this, I feel like, where it was like, that's not our work. That's too dangerous. What about the children in the shelter? Like, you can't have a victim of human trafficking there with children. Like, and it sounds that we had that fight, 5, 6 years ago. And now it feels like we're back at that same spot where it's just showing people that this is already what we're doing. This is advocacy. You just tailor it to the unique needs of the survivor. I remember one time recently, we had a survivor who was seeking medical care from like an urgent care facility and had one of our advocates with her. And her probation officer arrived and demanded a urine test at her urgent care appointment. It was incredibly invasive and horrible and breaking every confidentiality limit there is. And the advocate walked through that process with her and was there to support her, and later reflected and was like, I cannot believe someone was treated like that for accessing services. And so I think it's even beneficial, like, for advocates to see it from that light, because like there would have been no one else there for this human being going through this really hard time if our advocacy services didn't extend to helping them through their substance use journey, whether they're in treatment or not. And I think that's also important for people to see, like, you're the only person that's going to show up for the domestic violence protective order hearing, but you're also the only person that's going to hold their hand while they go to their 30th urine test this month. So I think, like, keeping it within the framework of advocacy is helpful as well.